So Rafaele, tell me, how does sound therapy benefit ear health?
Ear health. Okay, Donna. Well, most people come to sound therapy because they have some kind of problem with the function of their ears. Now, that might be hearing loss, or it could be sound sensitivity, or ear-related dizziness, or even chronically blocked ears, like a feeling of pressure in the head, or of course tinnitus, which is ringing in the ears. So all of those different disorders can be helped by sound therapy.
Well, for example, someone that has tinnitus but has a lot of other issues, how will it help those? Sleep and all those other related issues?
Well, that's a good point, Donna, because often people who are suffering from tinnitus, ringing in the ears, will also have chronic sleep disorders, the tinnitus keeping them awake, or they may have stress, anxiety, be distracted. Now, sound therapy helps all of those conditions as well, because it's working not just on the ears but on the brain. It's calming the entire nervous system and replenishing brain energy, so it helps you to get a deeper sleep and to be calmer. And people say, oh, I've listened to the sound therapy, I just feel so tranquil, I feel fantastic. So it's really benefiting the whole emotional state as well as the ears. Now, I know you use it for people with tinnitus. Are there other types of ear conditions that you found it also helps, or other related conditions to tinnitus?
I know that there was one particular lady who, her testimonial's on my website, that she actually had quite severe physical condition, and the sound therapy actually helped her start speaking again. I just, the thing is that people send me, and you can read the testimonials on my website, they're there. This is not something that's like anything else that is available. There's so many things on the internet, and again, the research is there. This therapy has to be experienced. I mean, I would encourage each audiologist to purchase the Listening Foundation kit, utilize it themselves, and then, see how it works for them, because
it does benefit people without a specific hearing problem as well, doesn't it? It's good for someone who's experienced stress, sleep disorders.
Sleep, it's wonderful for sleep. And but this has been a challenge as to moving this modality into the United States. It's very, very well known in Australia, but many people who come to see me say, how come my doctor didn't tell me about this? How come the audiologist that I went to see didn't tell me about this? So I think it's something that until we can really educate other audiologists about this, it's going to be a challenge to really help patients really understand what this therapy is.
Of course, because people expect to learn about a product that helps the ears from their audiologist, because audiologists are the experts.
Right.
So yes, we very much want to work with more audiologists and have them involved in disseminating the program. Donna, you mentioned Perception, and Perception Plus is the name of your business. Can you describe a little bit about how you came to be working in the field of perception and what that means to you?
Well, what I found was that, perception is everything. And when I started to study more of Dr. Tomatis's work, the way that I was looking at the ear and how he described the ear as essentially navigating, it's the navigator of the entire system. And when we think of it that way, any type of symptom can benefit through sound. We know you can read about sound therapy. This is not new. And I don't mean the Sound Therapy International. I mean any type of sound therapy. We know how sound heals. We know how sound therapy is now being used in hospitals and with various practitioners. So this is just one other way to expand this out to help people. Can you, Rafaele, touch a little bit about, I know that there's been some work with using sound therapy with patients that have been in comas and things like that?
Yes, that's right. We have had a number of people report to us how when someone's in a coma and they really don't know if the person is going to revive or not, they've used sound therapy and just put it on the person while they're lying there in bed, and it does appear that it has helped to bring people back to consciousness and actually revive them out of the coma. And you know, it's putting in that stimulation, because as we know, people can recover from strokes if they're given the right input and the right rehabilitation. And the research in recent decades has proved brain plasticity, how the brain can recover if it's stimulated, the pathways can be rebuilt. And so although it's difficult to do that and it takes a lot of input, the same may be true with a coma, that if you can have the right input, then the person is more likely to revive. And so this is what we believe is happening with sound therapy. It's just that kind of very nourishing, positive stimulation for the brain, and gives a better chance, at least, of bringing the person back to consciousness.
Yeah, what I also would like to make a note of as audiologists, we have been limited in terms of what is available for us to help these particular patients. And I encountered this frustration when I began teaching a tinnitus course at the doctoral level. I felt a pull between tinnitus retraining therapy, which is what we all, those of us that, I don't want to mention how many years ago, but those of us that were trained as audiologists, tinnitus retraining therapy was really the only option, and a tinnitus masker or the use of a hearing aid. Hearing aids can be beneficial, we know that, for some patients. However, there appeared to be a missing link, a missing piece in my perception of this. And I must be honest with you, as an audiologist, I was leery even at teaching a conservative doctoral level course of introducing this initially, because I did not know how it would be received. As time went on, I just jumped in, and I actually last year had the students read a couple chapters out of the Triumph Over Tinnitus book. I think as audiologists, we've come to the point where it's going to go one way or the other. If we really want to help patients, we really need to look at expanding what else is available. And as audiologists, if we don't feel comfortable with that, then let's refer that patient out to possibly a practitioner that, you know, is working in that way. So this multi-modality holistic approach has called to me, and I just encourage audiologists to just take a look at the information. Just take a look at it.